For the first time, we heard from the new managers of Trumbull Regional and Hillside Hospital. Insight Health Systems spent their first 24 hours mainly assessing what state the hospitals were left in. Jeena Cadigan spoke to the company's president about how this transition will go and what still needs to get done first. Jeena.
Insight is mostly focused on Trumbull Regional right now. Their president says they have a lot of work ahead of them, but after looking at these hospitals, he feels they're in a good spot. After spending their first full day inside both Trumbull Regional and Hillside, representatives from Insight say they're off to a better start than they could have hoped.
Could the patients receive the highest level of care? Did we have the right equipment? Was that equipment, in good shape? And I'm pleased to say that those are. And so that's a very good thing for the organization and for the patients in the community.
Now they're faced to deal with what Stewart left behind.
From there, you really have to dive into the depths of sort of everything related to revenue. One of the biggest things in the hospital is the facility itself, the HVAC units, the boilers. Along
with fixing the cosmetics and the finances, staff members hope one of Insight's priorities is getting more people.
Slowly, steadily, people have been taking other jobs. I mean, we're not at a skeleton crew, but it's becoming really close, especially on nighttime.
A nurse at Trumbull Regional who wanted to remain anonymous says they're still working long shifts, sometimes 16 hours, and worries about how they'll continue to help patients with what they have now.
We're fighting, we're still trying to give the best quality of care. We care about our jobs. We work very hard. I just don't want to repeat a story.
Dr. Ranney, the president of Insight, recognizes they're dealing with a high turnover, but says it's a balance.
I would love to have 1 million new staff members, but if we can't pay them, then it's pointless. You need the right staff to be there, and so we will bring them in as we need to facilitate getting us across that finish line.
Insight's goal is to have the hospitals fully transitioned in the next 90 days. They eventually plan to buy both facilities and turn them into nonprofits. With more local news, I'm Jeena Cadigan.